Hello, I'm Dr. Vishal Pawar. I'm going to talk on very important neurological disorder, that is epilepsy today. There are various cells, neurons in the brain, which are required for functioning, normal functioning of the brain. So basically the neuronal function takes place due to electrical activity. So in epilepsy what happens is there is abnormal functioning of some of the neurons, and they generate abnormal electrical activity that leads to epilepsy. So there are different types of epilepsy. If the epilepsy starts from few neurons, it is a focal epilepsy, or it can start from the many neurons and it can be a generalized epilepsy. So these are the two important types. Coming to the symptoms in case of epilepsy, there are various symptoms by which we recognize that this patient is having epilepsy. Patient can have loss of consciousness, patient can have falls, patient can have movements of legs, upper limbs, lower limbs, patient can have confusional state, patient can have sudden staring look, and patient is unresponsive for particular time. Then even patients can pass urine, or even sometimes even stools in the clothes. So these are the various symptoms of epilepsy. So if a patient gets only one episode, it is called a seizure. But if a patient gets repeated episodes of fits, it is called as epilepsy. Now coming to causes of epilepsy, there are various causes of epilepsy. And the causes depends upon the age of the patient. For example, the causes in newborns are different, the causes in case of infants are different, the causes in children are different, adolescents are different, and in elderly the causes are different. So more commonly we come across with patients who have epilepsy because of infections of the brain, like tuberculous infection, or cysticercus infection of the brain, or because of previous history of any insult to the brain, like prior stroke or prior trauma to the brain, it can lead to epilepsy. Some infections in acute settings, infections of the brain can lead to epilepsy. So there are many causes of epilepsy. Now coming to the frequency. Some patients can have one seizure and later on they may not have seizure whole life, or some patients may have multiple episodes per day. So the seizure frequency varies from patient to patient. Then coming to triggers, the common triggers what we see in patients of epilepsy are not taking medications properly, lack of sleep, lot of stress, even some drugs can trigger epilepsy, and even alcohol can cause alcohol intake, excess alcohol intake can lead to seizures, aggravation of seizures. Then coming to diagnosis, how a doctor arrives to a diagnosis of epilepsy. Basically, doctor goes into detail how the event occurred. For example, he asks the witnesses what happened exactly during the event, what happened. He asks the patient what happened before the event. During the event, he asks to the attenders what happened exactly, how was the position of his eyes, how was the position of his whether there was any tongue bite, whether he passed urine in clothes, whether there were any movements of upper limbs or lower limbs. So first part of the diagnosis is history, and second is investigation. Doctor may order some investigations like some blood test, then scan, brain scan, usually CT scan, or in cases MRI scan may be ordered. And there are some specialized tests like EEG, electroencephalogram. It detects the electrical activity of brain, and depending upon the cause of the patients, on these basic investigations there may be some further investigation. So this is how a neurologist or a physician comes to a diagnosis of epilepsy. Now coming to treatment of epilepsy, it is a common myth that there is no treatment for epilepsy, but it's not like that. There are medications which do work for epilepsy, and there are many types of medications, and many newer type of medications have been developed which prevents the seizures. And now coming to first aid during a case of a seizure. During a seizure, there are some do's and don'ts, and there are some first aid activities which should be followed. Basically, it is very important for the parents or the teachers to recognize the symptoms of a seizure, because if they are not aware of this condition, they may mistake it for something else. For example, the teachers and parents should be told that sudden staring look or sudden confusional state for some time, then passing urine or stools in the clothes. They should recognize the symptoms of seizure and report it immediately. And of course, there are some do's and don'ts which should be carried when a patient gets seizure. For example, the common do's means what teachers or parents or the people around the person they should do is they should keep quiet. They should not make a chaos, and they should remove the person from getting injured, because for example, if a patient is sitting in a chair, they should make him lie down on the ground, and they should not they should avoid trauma to that person, to the patient. Then what they should do is they should remove the tight clothes, like for example tight tie or tight clothing should be removed. And once the patient gets seizure, he should be nobody should touch him. Usually it is a common practice that I have seen that relative starts rubbing on the forehead. That should be avoided because it can cause abrasions. They should not hold the upper limbs or lower limbs to avoid the movements. That is also another important precaution. Then other things that they should do, they should not push objects into the like spoon into the mouth, because it can injure the tongue, it can cause trauma to the teeth. So they should not forcefully put some objects into the mouth. So these are the common do's and don'ts. Then going to febrile seizures. So now I will talk about the febrile seizures. Febrile seizures are a type of seizures which are commonly seen in children less than 5 years of age. And in less than 5 years of age, 2 to 5% of children get a special type of seizure because they get temporary fever, high grade fever. So basically it is a very common type of seizure in children, and there is no serious cause behind these febrile seizures. The main thing what should be done in case of febrile seizures is to control the temperature. The control of temperature is very important, with the use of antipyretic medications, with the use of sponging of the patient, and basically short course of patients need short course of anti-epileptic drugs for the time being for 3 days when they are having fever. So febrile seizures are preventable, and they are common, but they are not they doesn't indicate any organic or serious underlying infection. Then coming to common myths about the epilepsy. So it is very important to epilepsy is a disorder which is associated with lot of fears, misunderstanding, discrimination, and social stigma. So there are various myths about epilepsy. First myth is epilepsy is a very rare disorder. So it is not a very rare disorder. It is common. 50 million people in the worldwide, they suffer from epilepsy, so it is not a rare condition. Second common myth is people with epilepsy are mentally ill. So it is not true. See, the patients who have who take birth after some developmental abnormalities of the brain, they do have mental abnormalities, but that is a very small fraction of patients with epilepsy. But majority of patients with epilepsy do have normal intelligence. Third is people with epilepsy are violent and crazy. That is also another myth. It's not that patients with epilepsy and there is no difference between the behavior of patients of epilepsy and non-epileptic people, but they do get some abnormal movements or some abnormal behavior may occur during the time of epilepsy, but otherwise they may be normal like us. Then third is children with epilepsy are dull. That is also another common belief, but it's not true. Some epilepsy causes of epilepsy, patients do have some mental abnormality. They have reduced scholastic performance, but majority of patients, as I have already mentioned, they may have normal intelligence. Another myth is epilepsy is a curse of God. That is a very common myth in rural parts of country, but it's not. It is very unfortunate that it is treated as a curse of God, and these patients, they don't get proper treatment with medications. So it is very important to educate the people regarding this epilepsy is not a disorder due to curse of God. Another important myth is epilepsy spreads by touching or coughing. It is absolutely incorrect. Epilepsy doesn't, it is not spread due to cough or touching. There are some specific causes of epilepsy according to the age groups. Then another common myth is use of an onion or a metal, etc. helps in terminating an ongoing epileptic attack. It's not true. Don't use onion or a metal, or don't rub the forehead of the patients. It is common practice. It should be avoided. It doesn't terminate the attack. There are specific medications which should be given during the epileptic attack. If the seizure, if the fits doesn't stop after 5 minutes, it is important to take the patient to hospital immediately. But it terminates on, usually all the seizures, they terminate on its own after a period of 5 minutes. Then epilepsy medications are ineffective. It's another myth. Epilepsy medications, there are a lot of advances in the treatment of epilepsy, and epilepsy medications do work in patients with epilepsy, and it is very important to educate the patient to take proper medications, because that is one of the important cause of recurrence of fits. They are not taking proper medications in proper dosage. Another myth is life of a person with epilepsy is miserable. That is, it's another myth. Life of a person with epilepsy is very manageable, and with the advent of science, with the availability of good medications for epilepsy, they can lead a good quality of life with advances in the medical field. Next myth is epilepsy is a hindrance in leading a happy and successful life. It's another myth. People with epilepsy can live a happy life. They can, if they are seizure free, if they are taking proper medications with proper advice, they can have a good life, a good successful career. So that's all. Thank you very much.